Hi, everyone. Thank you for joining our weekly COVID-19 webinar. We have these town hall presentations every Thursday at 6 p.m. Eastern Time, so please continue to attend each Thursday and invite others to join you. I'm McKenna Yarbrough. I'm the Mid-Atlantic Southeast Regional Director for Best Friends Animal Society, and today's town hall is Reopening a Different and Better Tomorrow. We'll be talking about some new and enhanced community-based programs. We have some great technology ideas to show you. We'll be learning how others are reopening and how to communicate with key stakeholders about some of the program changes that we're seeing as a result of COVID. If you haven't also heard, I want to bring up Best Friends has started a new podcast. Really cool thing. It's filled with industry stories, some very relevant, helpful topics, and it's done in a very creative way. Those podcasts are usually on the website every Tuesday and Thursday, and Tuesdays was very interesting. It was called, it's a great title, it's called Budgets Get Tough, the Tough Get Going. So obviously during COVID, a lot of us are concerned about our budgets. And so this program focuses on how you can keep those life-saving programs while also providing necessary services. So check it out. It's at bestfriends.org/podcast. So before I introduce our panelists, I got a few housekeeping items. Everyone is automatically muted for the presentation portion of the webinar, and that's so you don't have to worry about accidentally unmuting yourself. If you have a question at any point, just type it into the chat box to the right, and those questions will submit through the chat box to us, and they're only visible on our end. We may have a few times where we'll pause the presentation and actually answer one of the questions if it's relevant to the topic that we're talking about. Tonight, we actually have a lot of links and a lot of resources to share, so those will be posted in the chat as well. But then after the fact, we'll be posting those on our resource section of our town hall page. And I just want to make a note that everyone knows that we are recording this tonight, and this session will be on our website after tomorrow. And finally, there will be a Q&A, kind of a short survey that you all will receive, and we're asking that you please give us feedback on this webinar. But more importantly, we want to get feedback on some potential topics for future content for other webinars. So all the housekeeping is done. Let's first, before I introduce our panelists, I want to introduce Dr. Erin Katribe. She is our medical director for Best Friends Animal Society. And each week, Dr. Erin will come on and she gives updates on the latest COVID veterinarian practices and any updates from the CDC. So I'm turning it over to Erin.
Thanks, McKenna. So not a ton of new stuff this week. One thing I'll bring up that it's sort of veterinary is the Million Cat Challenge launched Portal Mania this week. And so through a number of different sponsors, Million Cat Challenge is giving away more than 1,500 free cat housing portals. So super exciting stuff. There is no better time to portalize than right now when I think our inventories are down. Applications are due May 15th, and so get those in pretty quickly and get entered into that. Other than that, I don't have much, but I will just bring up again something that came up last week, and that definitely ties into kind of our panel that's looking forward. And it's that the COVID-19 Spay, Neuter, and Wellness Clinic Preparedness Guide was published online last week. And so if you haven't yet had a chance to check that out, I definitely recommend that you do. It's more than a prescriptive, on exactly when and how you should restart or ramp up spay neuter. The guide really is more of a way to self-assess your clinic and your community. So unfortunately, there is not a magic bullet answer as to when or how to start or increase spay neuter. It's going to depend on a lot of things, including the COVID case status in your community, what your supply of materials and anesthetic drugs looks like, lots of things. This guide will help you make that assessment though. And the authoring groups that were involved in this have actually gotten some feedback already and are constantly updating and revising this and adding things. So even if you have had a chance to look at it, it is a living document, so I encourage you to go back to it. So check that out if you haven't had a chance, and I can pop the link in the chat when I'm done. And that is all I have for this week. So I will pass it back to McKenna and our amazing panelists.
Great, thank you so much, Dr. Erin. So it's time to introduce our panelists. Are we ready? So we have Nick Lippincott, and he is the Special Programs and Training Coordinator for Orange County Animal Services, and he is on our NACA board member. Woo-woo! Yay, Nick. Next, we have Shelly Delahousie, and I'm hoping I said that right. She'll tell me if I'm wrong, and she is the supervisor of Lafayette Animal Shelter. Welcome, Shelly.
Hi, everybody.
And then last, but definitely not least, we have Andrea Peterson, and she's the Senior Director of Operations with Lifeline Animal Project in Atlanta. Hi, Andrea.
Hi, thank you.
Great. So thank you guys so much for coming. I think this is a great topic, and it's an important topic for everybody listening, I hope. But I'm going to start first with Shelly. I'm going to put Shelly on the hot seat. So Shelly, the big overarching theme of today's town hall is basically how COVID pandemic caused shelters to pivot and change life-saving programs. And you had huge changes for your organizations in so many different areas. But I want to first start and have you talk about your foster program. I want to know how it was before COVID and then how you all evolved it.
Right, so we did change a lot during COVID, and it was pretty early on when I realized that COVID propelled us to actually do what we've always wanted to. And so I knew it was going to be a positive experience, and so far it's working. But pre-COVID, we did not have a foster program other than just for bottle feeders. And so neonatal kittens were the only things we were putting into foster homes. Once COVID happened, we quickly realized that we were probably going to close to the public, so we needed to get as many animals out of the shelter as we could, so that they wouldn't be there for God knows how long. So we put out a plea to our community, and we asked for people to foster our animals. We didn't know how long that would be, but we put the plea out, and our community really stepped up. We put about 50+ animals into foster homes, which was fantastic. And we quickly realized that these fosters were either going to adopt them or they were putting them out on social media and having other people adopt. So they were, getting videos and pictures, and we found out so much more about these animals than we would if they were to stay at the shelter. And so before COVID, we were reluctant to actually put our animals into foster homes, especially large adult animals, just because we thought most of our adopters, when they come to the shelter, they want to look for the animal and they want to leave with that animal that day. And so we thought if we put them in foster homes, they're not going to get the exposure that they would have if they were in the facility. And so maybe they would miss out on an opportunity of being adopted. But what we realized was these foster homes, they actually gained more exposure because they were on social media. They were getting, their friends were telling them about the dog that they were fostering or whatnot, and they were getting adopted in 2 or 3 times faster than they would in the shelter. So that's something that we really want to try, and we're going to keep going forward when we open up fully, I guess, if you could say. We're definitely going to foster more animals in the upcoming time.
So are you able to do adoptions right now?
Yeah, we're only doing adoptions by appointment. Our facility just opened up on Monday where the staff came back, but we are still closed to the public. So no one is allowed in the building. I'm sorry, the public is not allowed in the building. So we'll do parking lot adoptions. They make an appointment and I'll meet you in the parking lot, and we still maintain our 6 feet distance. We have masks. Everyone is maintaining the guidelines, and we're getting the animals out.
Great, awesome. And so the other big program I wanted you to talk about is your owner returns in the field by your field officers. Tell us about that.
Right. So before COVID, we had minimal effort in trying to find owners. Our officers would go out on a stray call or whatever, pick up the dog, bring it to the shelter, and hopefully we can find its owner. During COVID, we ceased all intake other than emergency only. So if it was a dangerous dog, we brought it in. But we realized that we could continue to do this and really try hard to find owners in the field versus taking them in. And so just this week, we really put out increased efforts to return to owner in the field. And so our officers are now going door to door and asking neighbors if they've seen this dog before, putting out yard signs saying we picked up a dog here, if it's yours, call us. Just things like that, posting on social media immediately when we pick up the animal to try to put a plea out to see if we can find the owner right away. So that's something that we're also going to continue to do in the coming days.
So I want to hear also about your managed intake. When we talked, you touched on a little bit of how you've changed how you handle your intake of strays and owners. So share what you're doing there.
Right, so this is really exciting because before we just had a no appointment necessary. If you want to adopt an animal, you just come to the facility and we'll help you out. During COVID, it was emergency only. We did not do any managed intake. We didn't do any intake at all other than dangerous dogs. And then after, now we do appointment only, and it really gives us a chance to mitigate having all these animals come in. So if someone calls the shelter and they say they have a dog that they want to surrender, we say, okay, we take down your name and number, we'll give you a call back because we have to schedule an appointment. One of our counselors then calls that person and figures out why they want to surrender. Is it because of resources? Can we help them with food? Is it a behavior issue? Can we help them with training over the phone? Can we, get them the help that they need to be able to keep this animal? We've only been doing it for 3 days now, but about 50% of the calls that we get, they're actually like, you know what, I never thought about that. I'm going to try this first before I bring it to the shelter. And so only half of the calls are actually making appointments and surrendering their animals. So it's been great and we love it.
So you've had a lot of change quickly, it sounds like, and some that you're still working on changing. So how are you all handling the communication part of this and communicating it with the public and key stakeholders?
Yeah, we communicate, of course, with the staff of what we're going to do, but actually communicating it to the public, we haven't done yet. And as far as the managed intake, we may not because most people, they don't even know what our surrender protocol is anyway. And so when they call and ask how to surrender an animal, we're just going to give them the new protocol that we're going to do an appointment. I think if we release make a public announcement that this is what we're going to do, we might get some people freaking out that they can't just drop off their pet. But if they just call and we talk to them first, I think that we can handle it a whole lot better. But we're going to see. I think all these protocols we're going to try for a while, and if it works, then later on down the road, we may do a press release to let people know, like, look, it's already working. We've been doing it for 3-4 months. Look at the data that we've collected. It's working. So that's kind of the approach that we're going to take.
I love that, actually. Have the data first and then say, look, this is why we're doing it. I think that's great.
Yeah.
So you mentioned you opened on Monday to your staff. So what is your plan for reopening? Like, how does that look for you?
Yeah, Louisiana still has the stay-at-home order until May 15th, and it could go further. So a little bit here and there on the local level, they're trying to do like safe shop guidelines, and they're putting out guidelines on how people can still open their businesses. And so for now, we're just doing appointments, and we're still close to the public. I'm not sure what that's going to look like later, but I'm sure it's going to be in phases where maybe we can only allow a certain amount of people to come into the facility at a time. People would need to, of course, still stay 6 feet away from each other, wear the masks. We're not sure what it looks like, but we're ready to adapt.
Great. So I'm going to ask this of all of you so you can start thinking about your answer. What is the one of your biggest lessons that you've learned through this whole process, through this whole COVID situation, pandemic, however you want to call it?
What I've learned is that these changes we're already going to make. We already wanted to do these things. We've already wanted to limit intake. We already wanted to do a foster program. We already wanted to have a return to field. It only pushed us to just do it, and we're already in a changing world. We're already, things are going to be different. So why not just try to change now? And it's difficult times. This is difficult for everyone, but let's do the best that we can to come out better on the other side of this.
Great, I love it. Thank you so much. So Nick, you're next. So take me back a couple months. COVID hit. You now have to figure out quickly how to operate differently. And I know one of the things we talked about operationally changed for you was having to schedule some of your basic operations services. So walk us through what you had to do to solve some of those problems and what the services were that you wanted to schedule, I guess.
Right. So probably starting about a year ago, and we'll come for full circle probably, but we started playing around with the idea that some of the other places have done with, trying to reduce and divert a lot of our intake. And the big goal for us was one that's the same for a lot of people in Florida across the country, and that's our little kittens. So our neonatals and working on an emergency foster program, we use the wait till late. That's our model that we put out. And using that and wanting to streamline so many processes in that to make sure we had success, we went to a really virtual platform. We used a lot of technology and tools to kind of, remove the boundaries and make things accessible and make things, streamlined across the board. And we started realizing slowly that we needed to apply that idea to more, situations throughout our shelter. So the next place we started looking, and this was pre-COVID, was our clinic. We thought, hey, if the Florida DMV, they're great, we love them, can actually do a really good job managing appointments and intake and people who are not in a great mood, just like a lot of the times our citizens aren't in a great mood when they come into our shelter. Unfortunately true. We can use that tool. So we started going there. We used a model much like our blood labs and our medical clinics for our care center, for our shelter clinic. It's one that I've heard about a lot of people using on the Facebook groups and our leadership pages, which is Waitwhile. It's a virtual queue, it's appointments. And again, before COVID, we were able to test this a little bit. And then COVID came, and in a heartbeat, we had to completely shift from let's test something to let's go all out. And within 2 days, we had to completely restructure everything in our shelter and go to an appointment only, managed intake when it comes to the animals and the people, dropping our shelter to allowing people in. We were tiered for a while. We didn't fully close. So we were having some times when people were coming in and still visiting, and we were trying to get animals out. But so we used the system, and more that we used it and employed it across the shelter in every single place, from field services to the clinic to the front desk to managing the people walking through our kennels to look for pets. We realized how effective it really was. And the hidden gem that was from all this was the citizens loved it. They loved that they could check it electronically. They loved they could sit in their car like it was a Chick-fil-A waiting for their food. They loved that they got updates beforehand, and they got a little comment card afterhand, when they left, to see how everything went. And the best part for us was we could reduce our staffing and having everybody in there because it was automated. So we've more and more embraced this we love automation idea, and it's worked so well for us initially. And now that's only just continued to grow as we go through everything, and we continue to use this model for our essential staff that's still in our shelter, for some of the care services that we still offer, for our foster care, for our wait till late kittens, for example, and even more so into our virtual adoptions that have continued to take place while we've been closed, which have been mind-blowingly successful, and the community loves it way more than anybody thought they would.
So I want you to show us Waitwhile. I mean, that's one of the technologies that I wanted everyone to kind of see and walk through. And I know that I'll let you take it over and show it. So,
Sure.
Go.
So I wanted to have a little fun, and I put McKenna on the spot and gave her a weird trial here. I said, we have this system to show. So let's go ahead and show it. So what I will do is...
Oh, there we go.
Show our system. So I don't know if McKenna, did we post up the link in our system in the chat for everybody?
Yes, the Waitwhile demo is in the chat. So everyone go click on the chat link, and it'll bring you up and allow you to kind of create your own, you tell them, and let them create their own person and kind of sign up, right?
Yeah, so I definitely say if you have the chance to do it, go ahead and click. You're going to see everything that we see. And if the panel wants to, and if the town hall and everybody here wants to, they can be our citizens for a couple minutes and go ahead and test this live. Don't worry, you won't break anything. I made this specifically for our little talk today. So this is just a very super short and sweet version of what we employed in our shelter. Which is a wonderfully easy to access public facing portal to schedule an appointment, for instance. Again, I did a super short version here. We employed, basically, we set everything up in clinic services, in our field services, our front desk, and our sheltering services. We ended up parsing each one of those and the services they provide into their own little categories. So let's say we wanted to how to do something to our shelter. Now, our citizens can go online, they can go from their phone, it's incredibly accessible. They can go on and they can see what we have available. So they want to come visit our shelter. They wanted to do this while we were still partially open. We set up a system like this. We said, hey, go online. They clicked shelter visit. It told them how long they were there for. And again, we had more information when it was live. And they could very easily go through and pick and see the dates they wanted to come. We like this system because it tells us, how many spots are left, and it really helps the people manage how much time they have. So if I'm a citizen, I know I want to come bright and early at 12 in the afternoon, right after lunch, when everybody's coming in for the day, and I can do my tests. Spell my own name wrong. We actually use this also to limit the number of people. We could use this system to make sure we had the right amount of people to make our health department happy within our shelter. And we also used it to do a custom field to say, hey, this is the dog I wanted to see, and they could know that. That's all it took them. It was that easy. They could add that appointment to their calendar. I would get a text message, and if anybody else is signing up, you would get a text message and an email right away. Yep, I just got it on my phone, and it says, hey, Nick, you're scheduled for an appointment at 12 p.m. on the 8th for the Best Friends virtual town hall, and it tells me how to manage it. So that part's great, but not everybody knows about it. Yeah, it's super easy. That's why we loved it so much. And the other part was, hey, when somebody just walks up, because we don't expect everybody to go to our shelter site and look like they're supposed to, there's the waitlist feature, which was great as well. It's just like the hair salon or the restaurants or anything. It's the exact same system, and we just modified it, and a lot of people are doing it, and it just has shown to work so well. It's the same system. My foster forgot to schedule their appointment for wait till 8. They can show up on site. They can go to our wait list. They can clinic, foster recheck, first available appointment. It's just them, and put in that same information, add them to wait list, and then they go. So I'm in Florida. What do we expect? All right, so we'll do consent.
That's so cool.
And as soon as that loads through, it'll add them to the wait list. Oh, I lied about my phone number, apparently. There we go.
Now everyone has your phone number.
That's fine. Everybody else has it anyways. One of the NACA parks, right? So what was nice about that on the front end, it's so pretty. And there it is right there. That's the public site still. And now it knows that somebody's waiting. And it knows how long they're going to be waiting for. So we could keep people from coming to our shelter when they didn't need to be, when we couldn't help them because they knew how long our waits were. And when we go into our back end, we can see, that Mickey's waiting and how many they're here for. The system estimated how long we could help them, even what they were here for, and the animal they wanted. And that quickly, we could help our staff kind of filter through and monitor what they're here for and help them as quickly as possible. Even more fun is they could use the system to automatically alert them that, hey, you can come back from your car, your dog's ready, or your cat's ready from their visit. So we could do all this. Yeah, we loved it, and they were done, and they were happy. We loved doing this. It was super easy to deploy. It gave us beautiful analytics. These are just really short analytics from the couple of days that we had to initially deploy it, showing us, how many came in, how many people we served, how many cancellations we had, and really broke down a wonderful idea of why people were coming to our shelter. for shelter visits, for just any reason at all. For surrenders, we only had 5 in that entire period. Stray drop off, and we had all of our analytics that usually we'd have to break into a Crystal report a lot of the time right here in front of us, and really easy to export. We still used Crystal and we still used Chameleon for a lot of things, but our visitor statistics are leaps and bounds better now. And we look forward to really utilizing that going forward. We look forward to working with other shelters in the area who also are starting to deploy the same system and comparing these analytics together and seeing, you know, hey, how long is it taking your shelter to do a surrender or, you know, a drop off or an adoption? And it's taking us 20 minutes less. Why? And we have this really easy to compare data that we can kind of collectively pull together now as we build this out, because a lot of other people in our area are jumping on board. So we're super excited about that. It's probably one of the shining stars to come out of this whole situation. I'm going to switch back and give this back real quick.
So I'm going to admit that I know there's questions out there for you on this topic, and I, for some reason, can't access the questions. That's not showing me what they're asking, but I know they're there. I don't know. I guess we can get those answers to them after the webinar if we don't happen to answer them all. So I'm sorry for everyone who's listening. We're trying to work through it, so maybe I will be able to in a second. So you talked a little bit about your internal, external collaboration, and so you're working with a lot of other rescue and other groups in that area, correct?
Yeah, we're definitely trying to. Yeah, go ahead. I missed you for a second. Say it again.
No, with this program, right? But also in other areas because of this.
Yeah, that is, again, when we talk about big surprises that have kind of come out of this situation, you know, when this started coming around, I admittedly felt a little bad to say, you know, in a lot of ways, our industry, you know, the profession and sheltering, so many unique benefits have come out of it that we're really excited about. It almost feels bad to say, you know, we're getting some great information out of this that we can use, but we really are. You know, one of those things that we in Orange County fall under Health Services Department. Obviously, health services is an incredibly overwhelmed portion right now of local government. And what was really great as we did this was we made a point to really put out there to the leadership and the people that we fell under and the mayor's teams and just communication, say, hey, we have this great system, and we made sure to publicize it and social media push. And when the time really came around, we had some unique surprises. For instance, our entire health services team in Orange County is now helping assist with COVID-19 testing. And we've ended up modifying the animal services check-in system to a county-wide health services scale to now manage COVID-19 testing for the entire county. We were able to, in 2 days, you know, use this really simple system that, you know, we were able to build out pretty quickly, copy paste it, make a couple changes, and modify it completely to deploy to citizens for testing. All of us were collectively petrified because we didn't know how it would work, and a lot would come back on animal services if it failed. But what we found out was using this system, we were able to do better than the state and admittedly some major governments who were also doing testing and keeping times that were an hour or longer for citizens to be tested down to under 10 minutes, usually 5 to 10 minutes to get an entire, you know, system of people tested, 300 something appointments a day. And by doing that, that's really where the shining star came out, because admittedly, we can be a little honest here in this town hall that a lot of people say, oh, animal services doesn't get all the recognition that they deserve, because they deserve it, but sometimes they don't get it because of how things are structured. This system has really just, you know, skyrocketed our division and kind of exposure in such a positive way to everybody else in the public and leadership. And we look forward to harnessing that to the fullest of our potential as we go forward and down the line. So that's been an amazing thing to come out of this, that we really think other counties and people in the area can really do, because it didn't take much to do it. It took us to be really confident and say, hey, we think this can work, let us help. And that's all it really took for us to kind of step up and really step out.
That's awesome. Okay, so you mentioned wait till 8, and I'm going to put you on the spot and make you show us that if it's possible.
Yeah,
So
let's see if I
tell
can-
everybody what wait till 8 is and then how it was changed during COVID.
Sure. So I mentioned it just briefly. Wait till 8 is the bare bones essentials of it is a kitten diversion emergency foster program that we set up at our facility for initially walk-in, kitten season drop-offs of neonatals and what we consider non-viable kittens in Orange County. Prior to this, I can be honest now and say, because it's been successful, I can really put it out there that if we had a cat come into our shelter historically without a mother, under 2 pounds, with anything potentially wrong, it didn't survive. And we were really happy to deploy this program because we used, just like I said before, the little bit of automation, a little bit of streamlining to really kind of trigger some social psychology in people and really empower our citizens and our public to realize they can do it. And, we created a very successful, something we're very proud of, kitten diversion program to save the lives of hundreds of these kittens that we could almost guarantee wouldn't survive historically. What you can see my screen, right, McKenna?
Yeah, looks great. I love this program so much, so much.
I remember the first time I met you, I showed this one off. We were just starting it. So yeah, what we did was, instead of saying, hey, I'm going to have a staff member or a volunteer who historically, has to rinse and repeat during the summer, a very hard thing to say that if I take in this kitten, it's not going to survive, and have to deal with that emotionally on their half and to deal with the citizen backlash who thought they were doing good. We used a very simple program. We modified a survey platform, JotForm, very affordable and free to start, and modified it to create a streamlined, basically, intake system that started with a very honest script. I'm sure, hopefully you guys can see that. That gave very honest, statistics and told people what was going on and said, hey, we don't want this to happen. We can only do so much. We need your help. And it's one of the first times we really stepped up and stepped out and said, we need you to make this happen. Otherwise it won't. And these animals won't survive. And really embraced the community perspective. The script was straightforward. Actually, McKenna, some of y'all's team helped us out on it. It was wonderful. Thank you for that. And after they went through this, they were able to guide themselves through it in the shelter. Nobody had to sit over their shoulder. They were really put up with 2 very simple questions. And they were given the questions of the choices of I decline, and I want to have the animals impounded. Again, remembering that screen right beforehand of kind of knowing the truth. And the other option of they want to participate. And I will tell you, during the pilot, we had a 98% I want to participate, because all the pieces click together a little bit in their head to say, okay, well, I've had this cat for 2 days anyways. I might as well try a little bit longer.
I love it.
Yeah, and we gave them the resources. We gave them the starter kit that many other milkman programs basically do. But what we did that was a little extra was, after they went through kind of the basic sign up information of giving us their stats, we got some basic intake information. We used the system to kind of branch people out. If they weren't part of our county and we couldn't help them, they'd answer that in here, and we'd still help them with resources by saying, hey, here's where your other shelters are, and they'd get that via an email by the time they hit the parking lot. And that's where the really key thing was, we think, that using the system, after we gave them supplies, after we sent them back out the door with the kittens, and hey, you'll be okay. Before they got back in their car, they had something that said, here are the tools, here are the resources. They had a book in their, a PDF in their email that showed them what to do by the time they got home. And we followed up with saying, hey, we're going to reach back out to you with a team. At this time, we were partnered with Kindness for Cats, like a Foster Pros group, and they guided them until those cats hit 8 weeks old. They were there as a resource. They could email them, text them, call them. Some of our awesome pros would help make house calls or deworm, and they just kind of did a little bit of an electronic hand-holding through the process, and it worked. We can still very successfully say that any animal that participated in this program has never had to face the idea of euthanasia because of it. You know, so that's a 100% mortality rate, basically euthanasia rate for a kitten that normally wouldn't survive into, if this cat enrolled, we could guarantee it wouldn't be euthanized. And that's been such a fantastic thing to say within our community, because it's something we never thought we'd be able to say.
So we are getting a question for you, Nick, and I think I'm understanding it right. What was the intake rate for the wait till 8 in the pilot?
Sure. So during the pilot, we started, it was actually maybe early beginning of last year. The initial pilot stats, we went through about the end of the quarter, and we went in through the, winter time. It was actually relatively low in the season. So we had maybe, I think, 175, almost 200 enrollments in our initial kind of stat period. And during that period of those, 100 and something, 190 individual citizens, not counting animals were about double. We had a 98% enrollment. So you're looking at maybe 2 out of about 190 that decided they didn't want to participate. Once they walked in and guided themselves through this form, both in, by the way, it's very easy to translate, they were enrolled. And we really think it was part of the psychology. Now, we knew there was nothing we could do about the person that walked in and said, I don't care. I'm not going to go on the computer. I'm not going to listen. I found this cat here. We know that person exists, but we know that we now have the resources we have more resources to put towards that one cat now to make something work and to maybe find a foster. So even those stats that normally weren't enrollments, still we were able to help because we had so much more time and effort that we could devote towards a single animal.
So I'm going to ask you this last question, and then I'm going to let Andrea talk a little bit about her foster program and some of the other stuff. What was your biggest lesson learned through this whole COVID?
Okay, I'm still learning a lot of them. I will be for the next couple of weeks. But what we definitely have learned is that, our staffs are amazing individuals, and we all know that. But I'm going to switch my screen back here. We also know that, there are so many people that have unique tools and unique abilities and are so good at stepping outside their comfort zone that when they need to adapt, they can adapt, and they can adapt really well. Again, our staff has moved from shelter intake to, electronic virtual adoptions and wait till 8 and meet and greets and, helping doing COVID testing, check-ins for health services during a pandemic. And every one of them have been rock stars. And it's because we reached out to them and found their, the things that got them intrigued and the things they'd be willing to help out in, and really weren't too scared to step outside of our comfort zone, both when it came to our procedures and our, staff. And throughout that, we've known that doing that has done nothing but really help us move forward. I think that is still the lesson we're going to continue to learn from all this.
I love that. I heard a quote, it was actually from my husband. I'm going to give him credit. He said, don't take away their struggle. Don't steal their struggle. Sometimes you have to let people work through some of this stuff, and then the change will come pretty quickly. So this is great. I'm glad your staff jumped into that. Okay, Andrea, it's your turn. So I know before COVID, you had a very good foster program. There was no question. Your foster program was pretty robust. But since COVID, how many animals have gone into foster, or how many are in foster for you guys?
So for us, it began the whole period of COVID. We consider when we started changing operations. We have been able to put, it was about a little over 1,300 animals into foster. And previous times, yeah, I know, it's insane. And this is just fostering, not even adopting.
Wow.
But they, in the same previous time, it was about 500, a little over 500. So just to kind of give you an idea, that same time last year, how insane that the amount of animals we've been able to get into foster has been.
And so one of the things I wanted you to talk about today is how you're keeping things organized. I mean, I can't imagine having that many animals into foster, and you're still doing adoptions from foster. So talk about, I know you have Trello board that you want to show, but talk about how that has all come about, how you kept things organized in the fosters engaged.
So we immediately started with a foster questionnaire on our website. And so that way, I'm trying to show if it's sharing my screen here, but we started with a
right? I'm sorry to interrupt
yeah.
you, but this is your Trello board. And I know you're going to show us something else, but I think it's fabulous. I mean, we all use Trello, or not all of us, I know I do, for like keeping up with tasks, and it's just, this is so cool.
Thank you. And we had a lot of, we basically have been using a Trello board since even before COVID started, and we were using it mostly as a matchmaking tool for our volunteers, so that way they can help. Since they didn't have access to our software, this was their version of being able to help to do matchmaking outside of the shelter. So when all of our animals went into foster, we found that we already had this tool that we could now kind of grow a little bit so that we can help find matches for all of the adopters that were flooding in. So that way we can try to get all of our animals out of foster and actually get them adopted. We were completely transparent with people wanting to foster. We told them our needs. We were mentioning everything that was so unknown with COVID. We didn't know how long this was going to last. We didn't know what the next day would look like. So we made sure to tell everybody what we needed. We needed fosters for medium to large, primarily blocky-headed dogs, but definitely medium to large dogs. We needed help with at least a 2+ week commitment, since we did not know how long this was going to last and what was going on. So even if people were willing to foster for, a night, a weekend, we were really honest with, hey, we need people to foster animals for several weeks if possible. We were also very transparent just about making sure that we didn't know what was going on. So we let people know we may do different things, different days. We want to make sure to communicate with you. So we created the online foster questionnaire, so that way it was automated. Similar to what Nick said, people can sign up to foster straight from their home, their laptops, their phones, and that questionnaire went to into a spreadsheet so that all of our staff could access it and keep track of everybody. And then from there, seeing what people were wanting to foster, we were able to match them with the animals in the shelter, and it helped pretty much clear our shelters. And we relayed that urgency about, we really need to get these animals out. We don't know what's going on. We know people may get sick. We know we might get shut down. Who knows? So the number one thing we knew was that we needed to get the animals out. We created SOPs so that the fosters knew what to expect when taking an animal. And so trying to organize.
Do you have that to show?
The
If
SOPs?
you don't, that's okay. I think it's cool. We'll make sure that everybody gets it after the fact. So it's a really
great.
I
believe we were going to put it. I believe we were going to put it in the chat. Yeah. And
sorry to interrupt you.
Oh no, you're fine. I was actually going to say, we created different ways to help people market their foster pets. We did this marketing toolkit showing them, the best way to get your animals adopted is you got to tell people about them, right? So similar to what Shelly said earlier, people would come into the shelter, look at all the different animals and say, I want to see this one, I'm interested in that one. Well, when they're all in homes and you can't really go out to the coffee shops and advertise your dog, so we're relying on a lot of virtual sharing, so to speak. So the number one thing you have to do is market your pet. So we showed how to take good pictures, all the different good lighting, things like that. Talked about doing bios for your pets, because even though somebody sees a cute face, they got to know what your pet's all about. Advertise how their personality, what they love to do, are they good with other dogs, anything that makes them endearing to people, anything that catches their eye. We also go over videos, because even though pictures are great, videos are so much better. It gives people more of an idea of exactly what your dog is like, and just captures their hearts, especially like when you see they look right at the camera, right at the video, and ask you to adopt them. And then we talk about all the different aspects of social media for your pets, using our groups so that way you can help market your pet to all of our followers, all the Instagram accounts. We have quite a few fosters that have created Instagram accounts for their actual foster, and using hashtags, just anything to help get them out there and get the word out that you have so-and-so and they really need a home and this is all about them, and it helps them also find the better match. And then we also do flyers, so to help so people can post them or share the flyer. We help with this, but we also tell people, we give them templates so that if you're capable of doing it on your own, be creative, make your own. People love this. It really helps them give buy-in to their foster, and really helps them own the adoption, trying to find them a home. We specifically have a content. You see that email right here. People, if they're not capable of doing this, if they don't want to do it, they don't have time, that's completely fine. We have them just email a picture, video, a little blurb. Hey, I found out that Baked Bean loves squeaky toys. Anything like that, they can email to our content team. So then we help to share it, whether it's on our Facebook post or all of our different advertisements for our pets to help them get adopted.
So I want to hear more about I would love to hear more about how you're engaging and supporting your fosters. If you don't mind, jump into that topic, just because I think you all are doing such a great job with that.
Thank you. We really needed to make sure that we were, again, transparent, that fosters knew once you take a pet, it's great. We wanted them out of the shelter, but we really want you to actually get them adopted. So we've done quite a few things. We created different, basically, support systems, so that way they knew if they had any questions, concerns, that they knew they could reach out to us. We do a weekly automated email for all of our new fosters. It's a series, so it starts out with some of the simple, basic things for adopters. We started like hashtag Foster University. So at the beginning of every week, we start with a new tool, like, hey, the first one was, let's teach your dog to sit. And we give them the tool, show them a video or, a link to the best way to teach your dog to sit. And then we ask them at the end of the week to submit your photos or your videos of your foster dog sitting. And it's really great because then we take those videos and pictures and share to everybody. So it just helps to market your pet even more. It helps to engage the foster parent with their pet. So hopefully helps them fall in love even more. It helps the pet to become more adoptable, trained, things like that. But the last one we did was really adorable. It was Leave It. And we got a lot of pictures of people like putting treats on noses. So we had like the cross-eyed, pictures, dogs looking at the treats, things like that. It was really, really successful. We also make sure that we have plenty of behavior resources available. We have some free trainer guidelines that the fosters can contact if they have questions. We do weekly Zoom calls, like with our foster parents. They're just like office hours. So that way, just trying to make it easier. If anybody has a question, they want guidance, anything, that we're easily available. We also use the Best Friends Vet Access app. So that way, if anybody has any medical questions, instead of one foster coordinator dealing with hundreds of calls in the middle of the night, they can go on the app and get that 24/7 access to a vet to see, is this really emergency, things like that, which has really not only supported the fosters, but it's supported the foster coordinators and the staff too.
That's great.
We also did create, I think it'll be shared, our foster adoption SOP. So similar to like what Nick was talking about, whatever we can make so automated and easy for everybody to do, the better. So we've got it to where fosters or adopters can apply, and we get the fosters engaged in doing the meet and greets virtually, usually at first, especially in today's age. And then if they decide to adopt, it's all done online, the payment, the application or the agreement, all of that. So that way the dog or cat never has to come back to the shelter at all.
So we're getting a question. What system do you use for automated emails and for all of that? For forms and stuff, I think is what they're asking.
Google Suite loves us. Right now, we do a lot of Google Forms. Yeah, Google Forms is how we've done most of our questionnaires. We are looking into something like different systems that might be able to encompass like all of our sources, not just with foster and adoption. But right now, a lot of our stuff is simple Google Forms to be that questionnaire. You can customize it, goes into that spreadsheet so you can save it and manipulate it however you need to.
So we're running close to time, so I want to make sure you talk about your Friendly Finder program. Tell us how it's changed since COVID.
Well, Friendly Finder is whenever we have somebody that has found a stray animal that they would, we would ask them if they could instead hold on to that animal instead of it coming into the shelter. We vaccinate it, we take its picture so that way it's showing up as like a found animal. So that way, obviously the intent is to find the owner. But if the owner never steps up, then hopefully that Friendly Finder will continue to foster or adopt the pet. So again, a way to keep the pet out of the shelter. During COVID, it is actually, it's been pretty successful with getting people to take them in because again, we communicate that urgency of keeping pets out of the shelter. We've actually also been really focused on getting our field services to do it in the field too. So if they come across somebody that, you know, found a stray, it's in their garage right now, instead of just, okay, we'll pick it up, take it to the shelter, we encourage them to become a Friendly Finder, and we say back, get it vaccinated, take its picture, but then it can come back to that founder's house.
So I think that your organization is one of the best at marketing and communications. And so I want you to give advice to others on how you think organizations should communicate to the public and stakeholders kind of the changes that have happened or the changes that those organizations might want to keep.
Communication is definitely the key. Yeah, I'd say communication is definitely the key. I suggest to definitely be proactive about it, proactive and timely. So if you make a change, if you have a new policy or procedure, get it out there to everybody as soon as you can. You want to make sure to control your narrative. You want people to hear what your new procedure is from you, so it's clear, versus hearing it from somebody else and it's only half true or half correct, you know. So this way it avoids confusion, provides great customer service. We definitely recommend being consistent, especially with COVID. Everything changes daily sometimes, so your communications might have to be daily. Just be consistent and with your message, with how often you communicate with everybody. We also to set your expectations. Right away, we got over 800 foster applications within like 3 days. We knew that we weren't going to get to everybody right away. So we made sure to let everybody know we are graciously overwhelmed with your support. Please give us a little bit of time and be patient while we try to find you a great foster pet. And people understand that, especially in this day right now. They understand that there's a lot of going on. And we made sure to use all forms of communication. We had a letter from our CEO put out there. We have a blog that changes, our Facebook social media pages, as well as emails.
I love blogs. I think everybody should have a blog, every organization. Okay, so we have questions for you. 2 things. One question that came in earlier was, do you all do background checks on your fosters? And then the second part of that is, do you plan on keeping the new foster process and the community in place when the COVID is over? Or are you planning on reverting back?
Well, first question, background checks, we do not do. If we had to do background checks, we probably wouldn't have been able to get nearly as many, if not even close to what we did to get in foster. But by engaging people, you know you can keep up with who they are. You got to just trust the community is there to help you. And as far as our new process, yeah, we are keeping this full force. Our new model is hopefully to have, right now we have about 80% of our animals in foster care, and we'd like to keep it that way. So we really have to continue to support our fosters. One of our shelters, it's so funny because like our number of animals in foster care have gone down, but that's because they're adopting them so quickly out of foster. Instead of using our own network, like Shelly said, everybody has their own network, and so they can adopt them out so much faster than even we can, especially now. So yes, we plan on keeping this going.
All right, and I have two questions for Shelly. I have one question for Shelly and one for Nick, but I'm going to ask you the same question I asked everyone else. What's the biggest lesson learned here?
The biggest lesson I feel personally is that the community is definitely capable of helping this problem we have with animal sheltering. You know, keeping animals out of the system, finding animals homes. We know that dogs and cats, they deteriorate in shelters the longer they're there, no matter how great your shelter is. Use the community. They can help, you know, with training, medical care, whatever it is. So just know that they're capable, and to make sure to communicate that with the community is definitely my biggest lesson.
I love it. Okay, so question for Shelly. Shelly, you mentioned your officers going door to door. Was there pushback on that for the potential exposure? That's a good question. Is there a way that ACOs can do this without that close contact?
Yeah, there was a little pushback in the beginning because they said, well, we have to stay away from people and you're asking us to go to people. So there was some pushback there, but our city actually provided masks for everyone,
Right.
which is great. And so we all have one to wear and one to wash. And I have a bunch of disposable from our vet clinic as well. So we equipped them with what they needed to stay safe, and also just remember to stay 6 feet away from each other. And then I reminded them, you know, when we go to the grocery store, we're still standing the same amount of space between people. So we don't have to go in their home, and we're not going in their home, but just knock on the door and then stay back and just ask them, you know, if they've seen the dog or not. So there was some pushback in the beginning, but I think they realized that they have the same amount of exposure just out, you know, anyway, and they don't really have to be so close to people.
Okay, so Nick, your program, where is it? Okay, so will the Waitwhile demo stay live so they can show their staff? So that was a big hit.
If you twist my arm, I think we can do that. 100%. We'll leave it up. We'll leave it up through the weekend. So we'll go through Monday, something like that. Pending our system crashing overwhelming demand, which it won't do. Yeah, we'll leave it up for a little while and let people play freely with it.
And I have one question that came in before the town hall. I'm going to rephrase it. Did these community-based programs cost you more money?
So we were really worried initially that it would cost us a lot more money. And that definitely goes to why we were so happy to share this information with other people and other leadership in the government. I will use this COVID situation as exact reason why. We knew that we were using a basic business model plan, $120, $140 a month for Waitwhile when we first launched it, and maybe $70 a month for Jotform, which we use for Wait Till Late. But because of this and because of how well we exposed the leadership, we have very quickly realized that the county, just like we benefited so much from it, the county as a whole is going to benefit from it. So instead of our budget having to be hit for a couple $1,000s a year, we're probably going to be hit for $0 a year because somebody higher up on the governmental chain is going to buy it for their department, and it's going to work for all of us. So great. No, it costs nothing now, hopefully.
And Shelly, did your community-based programs cost more money, or was it? No? How about Andrea?
No more money. I mean, everything that we did was really just policies and procedures, just changing the way we did things, but didn't actually cost anything.
Okay, so I think that's all the questions that I'm seeing right now. There are other questions, and we know that. So we're going to be sending out an email tomorrow with a lot of these resources that we've talked about tonight. And I just want to say this was a lot of fun. So thank you guys so much for coming out on a Thursday night and sharing all your wisdom. And for everybody who attended, really appreciate it. It was great fun.
Thank you, McKenna. Appreciate it.
Thank you. See you guys.
Thank you.
Bye.